Have you ever had a headache? Chances are you have. Almost all of us do once in a while. And chances are you took some kind of medicine to ease your headache. That medicine was most likely a relative of aspirin. Aspirin is a drug used to relieve minor aches and pains, to reduce fever, and as an anti-inflammatory medication. Aspirin was first discovered by Felix Hoffmann, a chemist with the German company Bayer, in 1897. Aspirin is also used long-term at low doses to help prevent heart attacks, strokes, and blood clot formation in people at high risk of developing blood clots. It has also been established that low doses of aspirin may be given immediately after a heart attack to reduce the risk of another heart attack or the death of cardiac tissue. Aspirin may be effective at preventing certain types of cancer. Side effects of aspirin are swelling of the eyes, face, lips, tongue, or throat, ringing in the ears or loss of hearing, wheezing, difficulty breathing, hoarseness or fast breathing, fast heartbeat, cold, clammy hands, hives or rash, bright red blood in stools, black or tarry stools, nausea, stomach pain, heartburn, vomiting, bloody vomit, vomit resembling coffee grounds. In March 2010, the Journal of Clinical Oncology published an article which showed that among women living at least 1 year after breast cancer diagnosis, aspirin was associated with a decreased risk of recurrence in breast cancer death. This was followed by an article in The Lancet, which used a review of 8 randomized trials totaling 25,507 patients and 674 cancer deaths. The research showed that after using aspirin, the death rate due to cancer was reduced by 21%.
What's the best way to reduce the fever of a cold or virus infection? Bayer Aspirin. Doctors recommend aspirin to reduce this fever. Recommend it repeatedly in public health articles, medical journals, personal consultations. Thanks to instant flaking action, Bayer Aspirin enters the stomach as a shower of tiny flakes, so gentle and so quickly absorbed that Bayer is ready to go to work instantly to reduce fever fast, while it also relieves accompanying aches and pains. Remember, doctors recommend aspirin to reduce fever and make you feel better fast. You also have your doctor's blessing when you give flavored Bayer Aspirin for children, for it's the exact 1 1/4 grain dosage pediatricians prescribe for children. So when someone in your family has fever of a cold or flu, take your doctor's advice. Reduce that fever with aspirin. Remember, Bayer Aspirin for adults and for children is the best aspirin the world has ever known.
World War I, more than 10 million dead, many from the infection of their wounds. After the war, research intensified to find safe methods of repelling the bacterial invaders. Among those on the case was Scottish physician Alexander Fleming. While studying Staphylococcus bacteria, Fleming noticed something unusual growing in the culture dish, a mold, Penicillium notatum. He saw that the bacteria surrounding the mold had died off, which led him to speculate the mold was producing a substance that was lethal to the bacteria. He named the substance penicillin. For the next several years, Fleming tried extracting penicillin and applying it to treat infections. But he was unsuccessful and eventually gave up. Fleming's work, however, proved invaluable. In 1935, scientists Howard Florey and Ernst Chain at Oxford University came across a record of Fleming's curious but incomplete work with penicillin and decided to investigate. This time they successfully extracted and purified penicillin. And in 1940, they tested it. They injected 8 mice with lethal doses of the bacteria Streptococci. Then they injected 4 of the mice with penicillin. Within hours, they beheld the results. The 4 mice not treated with penicillin were dead, but 3 of the 4 that had been given penicillin were alive. From Fleming to Florian Chain, the world's first antibiotic was born.
It was a
Penicillin is one of the earliest discovered and widely used antibiotic agents derived from the Penicillium mode. Antibiotics are natural substances that are released by bacteria and fungi into their environment as a means of inhibiting other organisms. It is a chemical warfare on a microscopic scale. It's used to treat many different types of infections caused by bacteria, such as ear infections. Penicillin antibiotics are historically significant because they are the first drugs that were effective against many previously serious diseases, such as syphilis. Our immune systems are usually enough to destroy harmful bacteria, as we have white blood cells that attack them before they multiply. Even if symptoms do occur, our immune system can usually fight off the infection itself. Nevertheless, these are instances where it won't happen all the time, and it's too much for our body, and they need help, and this is where antibiotics come in. Bacteria are constantly rebuilding their cell walls, which is how they protect themselves and maintain their structure. Penicillin works by damaging and penetrating these cell walls, thus killing the bacteria cells. Associated with the use of penicillin includes diarrhea, hypersensitivity, nausea, rash, neurotoxicity, and superinfection.
Penicillins and other beta-lactams bind to proteins called penicillin-binding protein, or PBP, which are bacterial enzymes that catalyze cell wall peptidoglycan synthesis. This binding interferes with cell wall synthesis and leads to cell lysis and destruction of the bacterium. Natural penicillins are effective against gram-positive cocci, anaerobic pathogens, and spirochetes. Penicillin G is also effective against the gram-negative coccus, Neisseria. Semisynthetic penicillins, which are chemically synthesized analogs, are effective against many gram-negative bacilli. Penicillin G is the first commercially available penicillin. It is poorly absorbed when administered orally due to acid inactivation in the stomach, but well absorbed if administered intramuscularly. The drug is also excreted rapidly in the urine. Penicillin V and some semisynthetics, such as ampicillin and carpenicillin, are resistant to acid and so can be administered orally. Subsequently, they are better absorbed, have greater bioavailability, and an extended duration of action.